everyone, welcome to my channel. Today we are going to deal with the operative instruments of the surgical instruments. So first instruments is the Hudson thumb forceps. As the name indicates, operative instruments or surgical instruments are the instruments that are used in operative or surgical at the time of surgery procedures. So first is the Hudson thumb forceps. The use of this instrument is for holding and manipulating delicate tissues. Next is the Babcock forceps. That is the Babcock forceps is used to grasp the delicate tissues in laser procedure. Alice tissue forceps. It is used for grasping organs and slippery tissue during electrosurgery. Next is Valsalem. Valsalem is nothing but to hold the tip of the cervix. This is the instrument used in OBG, obstetric and gynecology, and similar to Alice forceps, but they are long. The image of the picture of this Valsalem is same as that of the Alice tissue forceps, but it is a short forceps tissue forceps. This is a long tissue forceps. Next is artery forceps. As the name indicates, these are the forceps which are used for the holding artery, used for grasping, that is holding, compressing, that is to apply pressure or squeezing, and holding the end of an artery during the ligation, that is tying the knot. Next is Caucher's forceps, to hold tissues during dissection or to clamp blood vessels during surgery. Cheetle forceps, these to remove sterilized instruments from the boilers. Next is non-toothed dissenting forceps. As the name indicates, forceps, these are the forceps which don't have the tooth. So it is known as non-toothed dissenting forceps used in reconstructive surgery of eyelid. So next operative instruments is the tongue forceps. The use of this tongue forceps is to hold the tongue during the oral surgeries. Next is bone kaiser. It is for cutting and shaping the bone during the procedures. Next is cautery. It is also known as electrocautery, to burn the specific area of tissue or to remove the unsightly warts. Next is kidney tray, to collect waste materials during surgery or the procedure. Next is trocar, that is creates hole in body parts. Example, before laparoscopic surgery. Next is Davis retractor, to hold back the abdominal wall during abdominal or thoracic procedures. Next is Doyne's retractor. It is used in pelvic surgery. Doyne's towel clip. It is as a name clip. It is used to fix the draping towels, suction tubes, etc. Self-retaining retractor. That is, it allows hand-free operations during a surgery. So next is the instrument is a needle holder, or also known as Mayo-Hager needle holder. It is used to hold a suturing needle for closing tubes during suturing. So next is the Morris double-ended retractor, to retract strong structures like abdominal wall muscles, and it gives wider space to work. Next is mosquito artery or small artery forceps. It is used for holding cut edges to open up abscess, hold cut end of sutures. Scalpel blades. It is used for incision, that is to cut. They are available in the sizes 18 to 36. Scissors. These are various types of scissors used for various tubings, surgical dressing, gauze, suturing, etc. to cut the various tubing, surgical dressings, gauze and suture. So in this is iris scissor. It is used for ophthalmic surgeries. As the name suggests, iris scissor, it is used for ophthalmic surgeries. Lister bandage scissor. This is also bandage scissor. As the name suggests, it is used to cut or remove the bandages, dressings, gauze and tape. Metazenbone scissors. That is used for delicate cutting and blunt dissection of soft tissues. Next is Mayo scissors. It is used to cut the thicker tissues like fascia and muscle. So next is the ear syringe. As the name indicates, it is used to instill the irrigating solutions to the ear. Next is the sputum mug, to collect the expectorant from the patient. Sputum mug is different and sputum cup is different. In sputum mug, we have to keep an antiseptic or pour an antiseptic solution. Then we have to collect the expectorant from the patient. Reflex hammer, as the name indicates, this is a hammer used to identify the reflexes. To elicit, that is nothing but to bring out the deep tendon reflexes during neurological and physical examination. And the other use is to assess the functioning of the central nervous system and the peripheral nervous system. Next is ramper sponge holding forceps, and as the name indicates, it is a forceps which is used to hold the sponge, that is cotton, sterile gauze piece. Why it is used to hold? Because to clean the body parts before aseptic procedures. Magel's forceps used to place the ET tube correctly in a laryngeal inlet, or also it is used to remove the foreign bodies or throat inlets. Bone cutting forceps used to cut a bone or infected part of the bone. If any infection is present to the part of the bone, then that area or the part of the bone is been cut. Jolly's thyroid retractor. It is a self-retaining retractor used for thyroid surgeries to retract or to retract the skin. Dressing forceps, name indicates dressing forceps used to for dressing. This is the forceps which is used for holding dressing materials during the dressing, and it is also known as the thumb forceps. So next is the proctoscope or rectoscope, that is to examine anus, rectum and sigmoid colon. Aneurysm needle, that is to hold the delicate structures such as blood vessels or nerves. Asepto syringe, that is to irrigating of wounds or cavities. Tracheal dilator, as the name indicates, this is the dilator which is used to widen the opening made in the trachea during the procedures. Punch biopsy scissors, that is the scissors which are being used to obtain the biopsy from different parts of the body. AMBU bag, that is the AMBU, artificial manual breathing unit. It is used to provide positive pressure ventilation to those patients who are all breathing inadequately. Gelpi retractor, it is a self-retaining retractor which is used for small surgical site. Wet liner retractor, it is self-retaining used retractor which is used for basic plastic surgeries, joint, large bone or mastoid surgeries. Balfour abdominal retractor, it is also a self-retaining retractor which is used for specific abdominal procedures or lower segment cesarean section. So next is the laryngoscope, that is it is used for the visualization of larynx and ET tube intubation. So it has two types of blades, curved blades and straight blades. Curved blades are known as Macintosh and the straight blades are known as Miller. Next is Army Navy retractor, also known as right angle retractor, US Army retractor. The use of this retractor is to during plastic surgery or procedure to expose the skin. Ophthalmoscope, also known as fundoscope, it is used to visualization of fundus of the eye. So cat's paw or Walkman's retractor, it is a retractor which is used for the retraction of skin or tough fascia, nothing but the muscles. Russian tissue forceps, it is used for wound debridement and closure. Legenbach retractor, it involves in a lot of dissection in superficial muscle pain which requires a retraction. Example, it is used in the surgeries like hernioplasty. So this is all about the operating instruments or surgical instruments. If you have any doubts or queries related to this, you can please comment in the comment box, and subscribe to my channel and like the video and follow me on Facebook and Instagram.